Okay, so pharmacy, it is a small subject, but it is a scoring subject also. Okay, in if you focus on few areas especially, then you will get 5 to 6 questions from here, and you can score these questions very easily. Okay, there is not much um, twisted question from pharmacy. There may be some twisted question, one or two questions may be there, which may be some kind of twisted, but mostly straightforward question comes from pharmacy. If you know, you can give the answer in a blink of eye. Okay, so if you focus the pharmacy well, then you can easily score some 5 or 6 questions, 5 or 6 numbers very easily. Now, which are the areas mostly to focus? That is the can't miss topics of pharmacy. First of all is history. That is the which mainly about the pharmacopoeias. Then terms. There are some pharmacy related terms. Okay, pharmacognosy, pharmaconomy, pharmacophore, etc., etc. Then source of the drugs. Then collections, the time of collections, very important. Then vehicles. Okay, especially the alcohol and the preparation of the sugar of milk. Okay, and this purification process, these are very important, as well as the specific gravity of the liquid vehicles. Then old class preparations, the deviations, it's how these are divided, how the drugs are divided into old class, the old 9 classes, and their drug powers also, respected drug powers. Then exception of the new methods. Then potentization, different methods of potentization and different views about potentization. Then prescription, the parts of the prescription, and also the abbreviations. Then dispensing and acts. Okay, acts are very important. Now we come to the pharmacy history. So old school pharmacy, it starts from Atharva Veda. Okay, text is written. Okay, but we know that it is written by our text. It is we know that it is written by Atharvan, the rishi named Atharvan. Okay, who is the father of famous saint Dadhichi. Okay, you all know Dadhichi, who has donated his bones for the preparation of Vajra. Okay, to Indra. Whatever, Atharvan Rishi has written the Atharva Veda, who is the father of Dadhichi, and it was all about earthly things. Okay, and also the disease and their process of occurring and their curing. Uh, these are all discussed in Atharva Veda. Then from Atharva Veda, the various derivatives has occurred. From Atharva Veda, Agnivesh Sanghita is prepared. Then from Agnivesh Sanghita, Charak and Susrut Sanghita is prepared. Okay, Charak Sanghita mainly deals with the disease and their medicinal treatments, and Susrut Sanghita mainly deals with surgical treatments. Then Chinese pharmacopoeia, it is first Chinese pharmacopoeia is written by Li Shi Chen. Okay, then Arabian medicine, the famous physician Arabian medicine, it is known as who is known as Avicenna, okay, or Ibn Sina. He has written Canon of Medicine. Then Hippocrates, he 460 BC his birth was, and he said dolor dolorum solicit, okay, pain cures the pain. Next, Paracelsus, his important contribution was spagyric medicine. Okay, we should divide the parts of the medicine, then aggregate themselves to be used into the disease. Then Valerius Cordus of Nuremberg. Okay, Nuremberg was a city of Germany. Valerius Cordus, he has made the first modern pharmacopoeia. Okay, so first modern pharmacopoeia, father of modern pharmacopoeia was Valerius Cordus. Then the contribution of Chinese are very important: hydrotherapy, moxivation, acupuncture, and vaccination. Okay, so idea of vaccination first introduced, though it was used anciently in India, but it was not, the procedure was not typically written in Indian text, so it was the credit goes to Chinese. Okay, first mass vaccination was performed in the Ming dynasty in 16th century by Chinese, uh, by the order of the king of the Chinese Ming dynasty king. The whole state was vaccinated for smallpox, not by cowpox but by the scab of the smallpox itself. Next, come to the homeopathic pharmacy. First writing of pharmacy is in the Fragmenta. Okay, Fragmenta Dividibus Medicamentorum Positivus. Simon Sano Corpore Humana Observatis. It was the full name of Fragmenta. Here, the first mention of the pharmacy, that is the preparation of the drugs, is mentioned. Then, first homeopathic pharmacopoeia was by C.W. Caspary, 1825. C.W. Caspary, who has written the book Dispensatorium Homeopathicum. Okay, Dispensatorium Homeopathicum. It was the first pharmacopoeia, first homeopathic pharmacopoeia, 1825. Okay, next important pharmacopoeia comes into the year 1870. Okay, in England, it is BHP, British Homeopathic Pharmacopoeia. Next, 1872, Pharmacopoeia Homeopathica Polyglottica by Schwab. Okay, in Germany it was published, Pharmacopoeia Homeopathica Polyglottica by Schwab. Then in US Homeopathic Pharmacopoeia was published, that is named as United States Homeopathic Pharmacopoeia, 1878. United States Homeopathic Pharmacopoeia. Okay, which is different from HPUS. Okay, it is USHP. Now 1882, American Homeopathic Pharmacopoeia is published. Okay, American Homeopathic Pharmacopoeia is published by Borick and Truffle. Now 1892, Pharmacopoeia by Mahesh Bhattacharya and Company published. Okay, 1892, Pharmacopoeia by Mahesh Bhattacharya and Company. Okay, it is the first Indian pharmacopoeia. Now 1897, HPUS, which was actually not at that time the name HPUS was there. It is named in 1901. Okay, but actually it was modified and renamed as HPUS, but it is HPUS. It is published by Otis Clapp and Sons. Next, 1898 Pharmacopoeia Homeopathica Francais. Okay, French homeopathic, first French homeopathic pharmacopoeia, 1898. Then Homeopathic Pharmacopoeia of India, that is the official homeopathic pharmacopoeia of India. Okay, 1971. Then 1988 Pharmacopoeia Homeopathica Mexicana. Okay, Mexican homeopathic pharmacopoeia first. Next, 2011 Brazilian homeopathic pharmacopoeia. Okay, first Brazilian homeopathic pharmacopoeia, 2011. Next, types of pharmacy. One is pharmacy proper, another is galenical pharmacy. Okay, so Galen was such an influential public, such an influential man of ancient time, ancient uh, medicine, that his direction towards pharmacy is made a separate sphere, that is galenical pharmacy. And the other description, otherwise the description otherwise given from Galen, which is not matching the Galen, that pharmacy is known as pharmacy proper. Next, pharmacy proper has two types. One is official pharmacy, another is extemporaneous pharmacy. Okay, official pharmacy that deals with the preparation, preservation, collection, etc., and extemporaneous pharmacy that deals with the dispensing area. Now there are some other types of pharmacy known as theoretical pharmacy. That is the theoretical part, that is the official part, that is the theory which doesn't deals with dispensing. That is the theoretical part, how to collect, how to preserve, how to prepare. Okay, these all the types are known as theoretical pharmacy. Now practical or operative pharmacy, how to dispense. So dispensing part, that is the practical part. Okay, also the preparation procedure, these are also some practical aspects. So all these practical aspect or operational aspect are known as practical pharmacy. Next, institutional pharmacy. So some institution may have its own procedure of dispensing. Okay, so preparation procedures are to be maintained according to the official pharmacy. Those countries who doesn't have any official pharmacopoeia, they may have their different kind of preparations or different kind of collection or different kind of preservation rules. Okay, there in these countries, like some uh, like countries of Kazakhstan, they doesn't have any official pharmacopoeia, so they can prepare homeopathic in this country. If any uh, homeopathic hospital established, homeopathic pharmacy established, they can prepare, preserve or collect homeopathic drugs according to their own. Okay, their institution, there may be a separate institution pharmacy, but in India, where uh, official homeopathic pharmacopoeia is there, here we can't make a separate kind of preservation or preparation or collection rules, because these are fixed. We should follow the official homeopathic pharmacopoeia. So where we can make some different arrangement in the dispensing area. In dispensing, the institution may follow its own rule. In dispensing area, one may follow the rule of giving dry dose, like in sugar of milk, only to be dispensed in sugar of milk, or they may be uh, form a rule of wet dose, like you have to only dispense in water along with alcohol. Okay, so here official pharmacopoeia like HPI can't set any rule, or official homeopathic pharmacopoeia has not set any rule of dispensing. So it is the here institute can form its own rule. Okay, so that is called institutional pharmacy. Now clinical pharmacy, in the clinical setting, uh, the pharmacy which pharmacy is to be followed is called clinical pharmacy. That is also deals with the dispensing part. Then wholesale and retail pharmacy, the distribution and preservation, stocking, these all the procedures are to be mentioned in wholesale and retail pharmacy. How much wholesale uh, quantity we can preserve, or how much day we can preserve, these all written in wholesale and retail pharmacy. Then ultimately Sphagyric pharmacy, it is nothing to deal with homeopathic pharmacy. It is a concept given by Paracelsus. Okay, here in Sphagyric pharmacy, the drugs, the main component of each drugs have been separated and then again mixed together to used in the disease. Then pharmacopoeia is two types, one is unofficial and another is official. Unofficial is not recognized by government and official is recognized by government. Okay, example is, it is in India, it is Mahesh Bhattacharya homeopathic pharmacopoeia. Okay, and official pharmacopoeia is in India HPI.